Stress Less Podcast. Hello and welcome ER Cocktails YouTube channel. Today we are talking about topic how to stress less. The podcast that helps you cope with stress and live a happier life. I'm your host, Jane Doe. In today's episode, we will discuss some effective ways to release stress for patients who are dealing with chronic illness or pain. We have a special guest with us today, Dr. John Smith, who is a psychologist and an expert on stress management. He will share with us some tips and techniques on how to relax your mind and body and improve your quality of life. And don't forget to listen all the way through for a chance to win a free copy of his latest book, Stress-Free Living. Dr. John Smith is a licensed psychologist and a certified stress management coach. He has over 20 years of experience in helping people overcome stress and anxiety in various settings such as hospitals, clinics, schools, and workplaces. He is also the author of several books on stress management, including his latest bestseller, Stress-Free Living: How to Achieve Balance and Harmony in Your Life. Dr. Smith, welcome to Stress Less.
Thank you for having me, Jane.
It's a pleasure to be here. Topic number 1. What is stress and how does it affect patients? Stress is a natural response to any challenge or threat that we face in life. Stress can be positive or negative depending on how we perceive and cope with it. Positive stress can motivate us to perform better or overcome obstacles. Negative stress can overwhelm us and cause physical and mental health problems. Patients who are dealing with chronic illness or pain often experience negative stress due to factors such as uncertainty, loss of control, fear, isolation, stigma, etc. Negative stress can worsen their symptoms, impair their immune system, affect their mood and cognition, and reduce their adherence to treatment. Topic number 2. What are some common sources of stress for patients? Some common sources of stress for patients are: diagnosis. Receiving a diagnosis of a chronic illness or pain condition can be shocking and devastating. It can trigger feelings of denial, anger, sadness, guilt, or hopelessness. Treatment. Undergoing treatment for a chronic illness or pain condition can be stressful due to side effects, costs, inconvenience, uncertainty, etc. It can also interfere with daily activities such as work, school, family, hobbies, etc. Lifestyle changes. Adapting to a chronic illness or pain condition can require significant changes in lifestyle such as diet, exercise, medication, self-care, etc. It can also affect one's identity, roles, relationships, goals, etc. Coping skills. Coping with a chronic illness or pain condition can be challenging due to lack of knowledge, skills, resources, support, etc. It can also depend on one's personality, beliefs, attitudes, etc. Topic number 3. What are some effective ways to release stress for patients? Some effective ways to release stress for patients are: relaxation techniques. These are methods that help calm the mind and body by reducing muscle tension, heart rate, blood pressure, etc. Some examples are deep breathing, progressive muscle relaxation, meditation, yoga, tai chi, etc. Cognitive behavioral therapy, CBT. This is a type of psychotherapy that helps change negative thoughts and behaviors that contribute to stress. It teaches patients how to identify, challenge, and replace irrational beliefs, cognitive distortions, maladaptive coping strategies, etc., with more realistic, positive, and topic number 3. What are some effective ways to release stress for patients? Some effective ways to release stress for patients are: relaxation techniques. These are methods that help calm the mind and body by reducing muscle tension, heart rate, blood pressure, etc. Some examples are deep breathing, progressive muscle relaxation, meditation, yoga, tai chi, etc. Adaptive ones. Mindfulness. This is a state of awareness that involves paying attention to the present moment without judgment or reaction. It helps patients focus on what they can control rather than what they cannot, accept rather than resist their situation, and cultivate gratitude rather than resentment. Social support. This is the availability and quality of relationships that provide emotional, practical, informational, or spiritual assistance to patients. It helps patients feel less alone,
more understood,
more valued, and more hopeful. Some sources of social support are family, friends,
peers,
professionals,
online communities,
support groups, etc. Thank you for watching. Please click subscribe for more video.